This is a study where we used computer simulations to improve a very specific pathology, a very specific cardiovascular condition called cerebral vasospasm. Cerebral vasospasm is a condition that affects our cerebral arteries, often as a consequence of a previous event, stroke or a bleeding or a hemorrhage due to the rupture of, for example, an aneurysm. And it manifests itself as a narrowing. It's believed to be a self-defense mechanism of our cardiovascular system that tries to stop the bleeding by narrowing those vessels. It occurs in a significant number of stroke patients. About 20 to 40% of patients will develop vasospasm. It's a major cause of brain tissue cells death, cerebral ischemia, and it has significant costs, which are mainly due to the longer hospitalization, but also due to the long-term healthcare, because it tends to affect relatively young patients. But the problem we work on is focused on the diagnosis of the disease. At the moment, this is performed through an ultrasound-based technique. In short, the ultrasound approach, echo-Doppler, will detect variations in the velocity. It's what in engineering we call the Bernoulli effect. We have a vessel narrowing, the same amount of blood flow will have to go through to maintain perfusion through a narrower passage, so velocity will increase. So when this technique is used, it can detect increases in velocity compared to baseline values, and it's quite effective. The problem is when you have the vasospasm affecting peripheral vessels. So you can't reach those vessels, you don't even see it up from an angiography, you cannot point the ultrasound beam to detect those increases in velocity, and very often in the clinic, vasospasm is diagnosed by exclusion of other pathologies. So we don't have, the unmet clinical need is that we don't have at the moment a direct method to diagnose vasospasm when it affects the peripheral vessels, which happens in a lot of cases. So a few years back, we decided to focus on a very specific capability of our cardiovascular system. And this is the capability of the system to generate pressure waves or pulse waves. So these are generated at heart level. It's the intermittent contraction of the heart that will generate these waves. And these waves will propagate through the elastic vessels of our system. And then something very interesting happens with these waves. Whenever these waves come across a point of change, what we call a point of discontinuity in the system, this can be a bifurcation, a change in the anatomy, a change in the elasticity of those vessels, they are reflected. So there will be a reflected wave coming in the opposite direction. And these changes sometimes are also caused by pathology, like vasospasm. So when we measure a wave, when we take a value of pressure along time, along the cardiac cycle, we see waves like these, and these are really a superimposition of the incident wave coming from the heart and the reflected waves coming back from all these reflecting points. So these waves, as they travel along the cardiovascular system, they gather information about the system through which they travel, and they carry that information at other locations. And this is exactly where we focused our modeling approach. We wanted to develop a model that was capable of capturing this physics and simulate the presence of a disease, in this case vasospasm, and see the effect of that vasospasm on those waves. See whether there was a signature on those waves to identify better biomechanical markers of the disease. So we developed a model. We called it OpenDF. It's a model that captures with a high level of accuracy this physics of wave propagation in an arterial system of 77 arteries. including, of course, the cerebral arteries, where we want to simulate vasospasm. It's based on properties of a typical individual, typical healthy individual, which you'll see is a limitation of our approach. We went through a thorough quantitative validation where we compare our predictions with data coming from other models published in the literature, but most importantly from experimental data as well. And then we made it available. This model is available as an open source on an open source license. It can be downloaded. The source code can be downloaded. It's fully documented. There are tutorials. So if you're interested, you can have access to this. And the community is already contributing to further development of the model. So we have the model now. We can simulate vasospasm, and so we did it. So we used the model to test this very specific hypothesis. We wanted to see whether by simulating vasospasms or contraction of these vessels in the cerebral arteries, we could identify in the shape of these waves any feature that was changing. And we wanted to see whether these biomarkers were more accurate in the monitoring the progression of the disease and the diagnosis as well, compared to current biomarkers. But we crashed very soon against the first wall, the first challenge. This model was developed based on a typical individual. So all the elasticity, properties of those vessels, the lengths and diameters are all based on a typical individual. And we know that we are all different. We will have vessels of different lengths and different diameters, different elasticity as well, which will also have an effect on those waves, on the shapes of those pressure waves. So in our challenge to find better biomarkers, we wanted only to find those that were sensitive to the pathology, to vasospasm, but not sensitive from all the other possible physiological variations that you come across naturally, physiologically in a population. So we had to do what we call in engineering an uncertainty analysis quantification. We wanted to run a lot of analysis of this model, where for each analysis we changed these parameters within the physiological ranges to then study the effect on the shape of these pressure waves. So the 1D model takes about 5 to 10 minutes to produce a result. We estimated that it would have taken us 9 years to have, to complete the uncertainty analysis. So I knocked on the door of Professor Clayton here in Sheffield, who is provided expertise on a machine learning technique called Gaussian process statistical emulators. I'm not going to go into the details of this, but these are approaches, statistical approaches, machine learning approaches, really, that from a few runs of the model can learn the behavior of that model and can emulate that behavior in a fraction of a time. So we used it to do our uncertainty analysis, and we completed that analysis rather than in 9 years in 2 hours. And the results are these, and without going into the details, here we have a number of features of that shape, of that wave, and the sensitivity, which is indicated here by darker color, to the changes in the parameters that describe that model. And what we observe is that the most influencing parameter is, of course, radius. But we really wanted to sub-select out of all these potential biomarkers only those that showed high sensitivity to, with respect to changes in diameter, because we want to diagnose better vasospasm, but they had less influence from all the other parameters. So we came up with a subset of those that in a different way describe that shape of the wave. And then we use these biomarkers to simulate and to see whether these biomarkers were changing in a simulated, in a virtual environment. Before doing so, we extended our cerebral network and to describe the details and intricacies of our anatomies. And we based this development on a beautiful anatomical study from a group in the US led by Roton. So we described all the ramifications after the middle cerebral artery there, which are the locations where usually we have, and we see this vasospasm, a very common location for aneurysms, and therefore for subarachnoid hemorrhage when they rupture. And then we asked the clinicians involved to give us a number of vasospasm types, typologies. Here you have a comprehensive example of what and how we simulated vasospasm progressing forward and backwards from peripheral vessels, only affecting the superior branch after the MCA, only the inferior branch, or both branches. And these are the results. So these are the results where we compare our methodology with the current diagnosis. Okay, so we are monitoring what is happening to velocity, mean velocity, at a point in a vessel which is also affected by vasospasm. And we see this. We see what we see also in vasospasm patients. We see an increase of velocity. Our model predicts that pretty well with respect to baseline values as the vasospasm becomes more severe. But the problem, remember, was to detect and diagnose vasospasm when it's affecting the peripheral vasculature. So this case really. Here, in this graph, you see the velocity. The velocity, yes, decreases here when it's affecting the peripheral vessels for a change in resistance. But it's only evident when this variation is only evident when you see severe progression of the vasospasm. Whereas using our biomarkers, in this case, the slope of the minimum slope of the waveforms, you see that the novel biomarkers that we identify are much more sensitive to these variations, and we also see this in the waveforms. We see a definitive change in the slope or gradient as the vessel narrowing becomes more severe. Now we are looking at performing the same study on a virtual population, but most importantly, we started a clinical study in collaboration with a group in France, where they are measuring and they are testing and validating our biomarkers on real vasospasm patients. Of course, this is not the work of only a single person. These are all the collaborators here. Many people from Insigneo, of course, clinicians and engineers participating from other countries as well. But the king of the team, I would say, is Alessandro, who developed the OpenDF model and ran the analysis for this study. Thank you very much.